Good morning, everyone. Welcome back to those of you who attended our first keynote, and welcome to anyone who's just joining us this morning. We're excited to hear from Kristin Mayel of the Good Shepherd Food Bank for her presentation on hunger and health. A couple quick updates and reminders before we begin. You can please complete the session evaluation that is now located back on the session page under the feedback button, so you can easily do it there. And as a reminder, if you have any questions for Kristin in her presentation, you can use the ask feature and enter your questions there anytime, and we'll make sure she gets those at the end. But with that, I would love to introduce Kristin and thank her for being with us this morning. We really appreciate it. We're excited for your presentation. Kristin is the president of Good Shepherd Food Bank, which works with a network of more than 500 nonprofit organizations to distribute 29 million meals a year throughout the state to people in need. Before her role as president, she was the founder and program director of Cooking Matters Maine, a local chapter of Share Our Strengths nationally recognized cooking and nutrition education program for low-income families. And prior to her work with food security, Kristin worked for over a decade in the private equity and business consulting fields. After volunteering for hunger relief organizations, she decided to make her passion for ending hunger her occupation. So thank you so much, Kristin. We're excited to have you and look forward to your presentation.
Thank you, Heather. And I want to thank the Maine Public Health Association for inviting me to join you today. I'm looking forward to sharing with you some information about hunger in Maine and its impact, especially its impact on people's health. I will share what Good Shepherd Food Bank and the Hunger Relief Network is doing to address hunger and, and increasingly to address the health impacts of hunger. And what I'm really hoping you'll come away with is an understanding of how the work of ending hunger can be a powerful preventative healthcare tool for our most vulnerable populations. Because a vision that I know we all share is we want everyone in Maine to be able to live their best lives, and they can't do that if they're hungry or in poor health. So let's first talk for a bit about hunger in Maine. Nearly 13% of Maine households struggle with hunger, including 1 in 5 children. That ranks Maine 12th in the country for overall food insecurity and 7th in the country for very low food security. Last year, Maine's food insecurity rate declined for the first time in over a decade, but we still remain higher than the national average, and we have the highest rates of hunger in New England and in the Northeast. And of course, all of these numbers are pre-COVID. It's estimated that Maine's rate of hunger will grow by 40% due to COVID, meaning the projected food insecurity rate will rise to 18% for overall households, and the children's rate is expected to grow by 48% to nearly 1 in 3 children in Maine living with hunger. These numbers are absolutely staggering and have real immediate impacts on people living with hunger. So 35% of food insecure households contain children, 40% of food insecure households contain seniors, and half of food insecure households contain people with disabilities, meaning that hunger really disproportionately affects our most vulnerable citizens. So why is hunger such a big problem? Well, since 2001, Maine has lost nearly 37,000 middle-class jobs. And these mainly have been replaced with low-income jobs in retail, hospitality, and food service. So even though pre-pandemic, the unemployment rate was really low, it was really masking what was happening on the ground. People are working. The problem is they're just not earning enough money. 1/3 of all Maine jobs are low wage. So sometimes people are working even 2 to 3 jobs just in order to be able to earn enough money to put food on the table. The jobs do not pay enough to cover basic needs, and they rarely come with benefits such as health insurance or paid sick leave. Between 2012 and 2015, approximately 31% of real household income growth went to the wealthiest 5% of Maine households, while the poorest 25% of households realized just 0.2% of real income growth. Prior to COVID, Maine's economy was already 1% smaller than it was before the Great Recession in 2008. This compares with 8% larger for the New England economy and 13% for the United States as a whole. Many people often ask, What does food insecurity mean? And why don't you just say hunger? Well, maybe we should say hunger because it certainly does drive home the urgency of the issue, but food insecurity encompasses more than the immediate physical discomfort of being hungry. Food insecurity recognizes the ongoing struggle of not having access to enough food and the stress that that causes. So maybe you ate today, but will you be able to have the resources to be able to provide food tomorrow? And we're learning more about the impact that food insecurity has on a household. Beyond the physical implications, constantly having to worry about where your next meal is coming from puts debilitating toxic stress on a family and forces them to regularly make heartbreaking decisions in order to get their most basic needs met. Seniors having to choose between taking their medication or buying food, families having to decide to pay the heat bill or buy food, mothers telling their children that they're not hungry so as not to discourage them from eating enough. So now let's shift for a moment and highlight some public health statistics in Maine. Maine suffers from some of the highest rates of diet-related chronic diseases in the Northeast, including the highest rates of obesity and type 2 diabetes. Now, for most of us, if we go to the doctor and we're told that we're overweight or our numbers are indicating that we're pre-diabetic, what's the doctor going to tell us to do? Likely, they're going to say exercise and change your diet. But what if you can't change your diet? Food insecurity increases the risk that an individual will develop a chronic disease such as cardiovascular disease, diabetes, kidney disease, and osteoporosis. Once someone has a diet-sensitive chronic disease, being food insecure makes management of that disease much more difficult. Research shows that food insecure people with diabetes have increased medication non-adherence, more trade-offs between food and medicine, poor diabetes distress and self-efficacy, and most importantly, poor blood sugar control. And we see these challenges with other diseases as well, including hypertension, HIV, and cancer. According to a study of working age adults living at or below 200% of the federal poverty line, they found that lower food security is associated with a higher probability of each of the 10 chronic diseases examined. In fact, the study found that food insecurity status is more strongly predictive of chronic illness, even than income. And the health impacts of food insecurity on children is equally disturbing. The American Academy of Pediatrics policy statement on promoting food security for all children states that children who live in households that are food insecure, even at the lowest levels, are likely to be sick more often, recover from illness more slowly, and be hospitalized more frequently. Lack of adequate healthy food can impair a child's ability to concentrate and perform well in school, and is linked to higher levels of behavior and emotional problems from preschool all the way through adolescence. Regardless of age, food insecurity has been linked to a number of negative health outcomes. For seniors, food insecurity significantly impacts their ability to achieve activities of daily living, and it's often the reason for seniors having to leave their homes. Not surprisingly then, food insecurity leads to higher healthcare costs to the entire healthcare system. These costs result from more treatment, the need for more treatment, hospitalizations, and readmissions. Research on patients who are classified as high-cost users show an association with food insecurity. In fact, research shows that food insecure patients cost the healthcare system an additional $1,863 per year compared to those who are food secure. Annualized, this is an additional $77.5 billion in additional healthcare costs every year that are just caused by food insecurity, which is an entirely preventable situation. So why does food insecurity result in poor health? From research and our work with food insecure families, we've learned that a combination of factors lead to poor health. Lack of regular access to healthy food leads to poor dietary intake. When you have a limited amount of money to spend on food, you're going to buy as many calories as you can for your dollar. And this causes people to fill up on calorie-dense, nutrient-void food. You're less likely to try new foods because you can't take the chance that your family won't eat it. You also will have reduced self-efficacy for healthcare needs. You'll have competing demands between food and medication, medical bills, and other demands on the household budget. And the cyclical nature of food insecurity means that food availability changes throughout the month, which can lead to binging and fasting cycles. And then, of course, there's the stress that we talked about when you're constantly worrying about food. All of this leads to an increased risk of developing a chronic disease. And then the poor health that's caused by the chronic disease then often results in reduced income and further need for spending trade-offs, and it keeps that household in that constant vicious cycle. So our goal is to create an upstream opportunity to have community intervention to address food insecurity to break the cycle. Because hunger and poor health are so interconnected, there is an opportunity here to tackle food insecurity together. But before we get to that, I want to just shift gears for a minute and just talk for a bit about the work that the Food Bank and the Hunger Relief Network does in Maine. So Good Shepherd Food Bank serves as the hub of a network of more than 500 community-based organizations who are working to end hunger in Maine. Our partners include food pantries, community meal sites, schools, senior programs, and healthcare organizations. We serve as the grocery store to these partners who are on the front lines distributing food directly to Mainers in need. Our job is to get the food they need to do their work. Over the past 10 years, we've responded to the growing problem of hunger. We've doubled the amount of meals we distribute. And last year, we provided over 29 million meals, reaching over 178,000 Mainers in need. While we're proud of our work, we know that we need to do more because, as I just shared, we know the impact that hunger has on families' ability to lead healthy, productive lives. We believe that ending hunger is the first step to breaking the cycle of poverty. So we have a bold goal that by 2025, all food insecure Mainers will have access to the healthy food they need when and where they need it. And in doing so, we will help stabilize the lives of the people we serve, reduce the impact of hunger on our state, and make Maine a stronger, more resilient place to work and live. And we think about accomplishing this goal by looking at our work across 3 areas that we call Nourish, Connect, and Empower. First, to nourish. Providing access to healthy food will always be the core work of the food bank, but we know that it takes more than food to end hunger, which is why we're also investing in programs that use food to connect food insecure individuals with other critical skills and resources, as well as looking for opportunities to improve community connectedness. And lastly, our newest work is identifying opportunities to include clients in informing strategy, giving them the opportunity to share their stories and inform how best to improve food security, recognizing that they are the experts in their lives and need to be part of the solution. So in the Nourish category, we are committed to distributing nutritious food. Currently, 82% of the food we distribute is what we call a food to encourage. This is up from 53% 6 years ago, and our goal is to get that number to 85%, so we're almost there. Over a third of what we distribute is fresh produce, and 2 million pounds of this produce, the produce that we provide, is purchased or donated by local farmers through our Mainers Feeding Mainers program. Over 150 of our partners receive direct delivery of farm fresh produce from a local grower. When we launched Mainers Feeding Mainers, we had 2 goals: to get local healthy food to Mainers in need and support our rural communities by strengthening food producing businesses. We've exceeded our goals in both those areas, but we've also learned of the impact this program has beyond the food itself. We have received countless thank you notes and heard so many stories of people being moved to tears when they see beautiful fresh produce that has been grown just for them. People who have become accustomed to always having to rely on someone else's cast-offs to survive. When you live on secondhand clothing, secondhand furniture, even secondhand food, you can begin to internalize that message and convince yourself that that's all you deserve. And I have been amazed at watching the power that fresh, healthy food can have on sending the message to somebody that you matter. So in addition to changing the kind of food we distribute, we've also been changing how we distribute food. For too long, food pantries have been operating in silos and fairly disconnected from other organizations that serve the same people. People living in the crisis of poverty prioritize food access because they have to. It's a fundamental need. However, they often aren't able to prioritize other resources that can help them build resiliency, such as disease management, job training, or other educational opportunities. So if we can combine food access with other resources, then we can make it easier for the people we serve to benefit from these programs. An example of this is our collaboration with schools, where we've learned that by putting food access points in schools, we're not only providing working families with healthy food, but we're creating the opportunity for parents and teachers to connect in meaningful ways that result in improved educational outcomes for kids. For example, we know that 88% of school pantry participants feel that the program has improved their family's communication with their child's school. And we know that parent engagement in their child's education is a critical component to closing the achievement gap. The next phase of this work includes improving our understanding of the communities we serve, investing in the capacity of our network partners, as well as identifying other community partners that we need to be engaging with in order to fully address the needs of the people that we serve. The food bank does a great job of moving a lot of food, but we do that by operating through hub locations throughout the state. We need to be more closely connected with the communities we serve, knowing that they are the experts in their communities, and we need to lean into that expertise to really understand the best way to deploy our resources to help strengthen food security across the state. I now want to highlight two programs that directly address the intersection of health and hunger. The first is our Community Health and Hunger Program, which connects healthcare providers and their patients to food pantries and healthy food options in their communities. First, what we do is we provide training. We educate clinical and non-clinical staff on the importance of asking patients about food insecurity, and we train them on how to integrate the hunger vital signs screening tool into every patient visit. We have multiple training tools and best practice guides that we utilize to tailor each training to the individual sites. Next, we provide the healthcare centers with emergency food bags to offer to patients that screen positive to the hunger vital signs questions. We discovered that most staff and providers are reluctant to ask non-clinical questions unless they can immediately address the problem. And then the most important part of this process is connecting patients to the federal nutrition programs and their local food network. We work with pantries to ensure that they can support referrals from healthcare providers and that they can offer patients healthy food options when they arrive. So developed in 2010 by doctors at Children's Health Watch, the Hunger Vital Signs is a 2-question screening tool based on the US Household Food Security Scale that identifies individuals and families as being at risk for food insecurity. If a patient answers that either both of the following 2 statements is either often true or sometimes true, then they screen positive for food insecurity. And the Hunger Vital Signs has been endorsed by the American Academy of Pediatrics since 2010. This is a picture of what's in the contents of the emergency food bags. They consist of 8 to 10 pounds of non-perishable dry goods. It is packed in a unlabeled white bag to be offered to food insecure patients at any time during their visit. We worked with our nutrition team to develop a menu that falls within the My Plate guidelines, as well as is suitable for patients with chronic illness. And this is an example of our community resource guides. We have them for every community in Maine. It includes information on how to sign up for federal programs such as SNAP and WIC and school lunch programs, as well as has information about how to access food in the surrounding communities, such as contact information for food pantries and other food access sites. So as of June 30th, which is our fiscal year end, so it's when we tend to start counting a lot of things, we had over 100 practices across the state participating in the screen and intervene model located in all 16 counties. 20% of our healthcare partners are also doing produce distribution in addition to the shelf-stable emergency bags. 5 of them are receiving produce directly from a farm through our Mainers Feeding Mainers program. We've screened over 200,000 patients across the state, and 10,000 of them have been referred to their local ending hunger partner. In total, we provided over 100,000 meals, including over 50,000 pounds of produce through this new channel. What's also been interesting is how many of our sites are now actually serving as one of the main food access programs, food access points in their community. Some of the sites that we've targeted are in areas where we didn't have a food pantry, and so now the healthcare site is serving as that hub for a community. One of those examples is the Federally Qualified Healthcare Center in Bingham, which has been a great partner of ours. This is an example of one of the produce pop-up distributions at the Portland Family Practice. All right, I now want to shift gears and talk about our nutrition education programming at the food bank. Historically, the nutrition work at the food bank started internally, making sure that that we are prioritizing nutritious food. We established a nutrition policy that guides our food sourcing team in determining which donations to accept and what kinds of food we purchase. This is included in increasing fresh produce, ensuring culturally appropriate foods are available, and we also stopped distributing candy and soda through the food bank. We are now shifting our focus to help support our partner agencies for them to increase nutritious foods that they're distributing, and doing it in ways that put the client at the center of our work. This ties into our work with Community Health and Hunger to ensure that those who are being referred to a food pantry have access to foods that are nutritious and can help to support any dietary needs they may have. This year, we're working to implement a nutritious pantry program in partnership with an organization called Leah's Pantry. This work will continue to ensure that all the pieces are in place to support health. Because we know that people who live in poverty have higher rates of chronic disease, we want to make sure that everyone is set up for success through healthy foods, nutrition education, and having cultural and dietary accommodations. Implementing this program is actually going to be a pretty big shift for ourselves and our network. Historically, food banks and food pantries were designed around what kind of food can we get? Where can we get it? Where can we get space donated? When can volunteers be available? We weren't set up thinking about where do we need to be? Where is it most accessible for clients to go to get food? What kind of foods do they most need? So this is really shifting that kind of scarcity mentality around and putting the client's experience at the forefront of all decisions. So by putting the client at the center of the work, we are working towards creating an experience where the right food is available at the right time and the right place. And that the experience is one that results in anyone who comes to a food pantry to feel that not only were they nourished, but they were seen and heard and valued. The other component of our nutrition education programming is our Cooking Matters program, which teaches low-income families the skills to select and prepare healthy, tasty meals on a limited budget. Since we started this program, we've taught over 30,000 low-income Mainers these life skills. The classes are taught throughout the entire state at food pantries, senior housing facilities, veterans' homes, correctional facilities, and hospitals. In fact, one of our fastest growing Cooking Matters partnerships are with healthcare providers. Because of the role that hunger plays in contributing to poor health outcomes, medical providers are seeing the value of Cooking Matters classes to help support patients' health. We've partnered with programs such as childhood obesity programs, adult obesity programs, and family practices. And one of our partners is the Dempsey Center, which supports people who have cancer, have had cancer, or are caregivers for people who are suffering from cancer, teaching them how to cook foods to support treatment and recovery. We teach people how to make the foods that they know and love, but in a healthier way, as well as providing the education as to why it's important to make dietary changes. We empower people through cooking. Cooking Matters has grown very fast in Maine because of great partnerships we've made throughout the state, including with Maine SNAP Ed, Let's Go, the FNET program, and lots of satellite partners who are implementing programming. One of the special features of Cooking Matters is that participants get to make a meal in class and also take home a bag of groceries to reinforce that learning in their home environment, which evidence has shown is the most effective way to really make sure that that learning is accomplished. The other thing that we've heard from the Cooking Matters program that's so effective is it encourages people to try new foods. I mentioned earlier that a lot of times families, especially families with kids, are really scared to try new foods. So maybe they hear that kale is incredibly helpful and pomegranates are the new superfruit. But if you don't know if your family's going to eat it and you're living on a really tight income, you're not going to take the chance of buying these foods to bring them home only to find out that your kids won't try it. Or as we all know, sometimes it takes your kids to try things 5, 6, 7 times before they finally come around to it. So having Cooking Matters provide the groceries for 6 weeks in a row to try new foods really gives families the chance to test out new ideas with their kids, as well as including their kids in the cooking, which we also know is a great way to encourage kids to try new food, especially new healthy foods. With our partnership with Maine Health, we've been able to provide training resources for anyone in the network who'd like to help support a class. So this could be doctors, nurses, or clinical support staff that have the tools and resources they need to be able to offer a class in their practice. These resources have been proven to be helpful, especially as we've moved from in-person classes to virtual classes. With COVID, we have moved to a virtual format to offer programming. We've created a YouTube channel with cooking, nutrition, and skills videos that can be used to help guide class participants through making dishes at home, while also engaging in discussion about the food they prepared, and as well as learning more about the nutrition lessons. The one thing that's been kind of a silver lining that we weren't anticipating is before some of our practice-based programs, we're disappointed that they could only offer classes to their patients that lived closest to the facility. But now with the virtual programming, they're able to open up classes to their patients who sometimes are driving, from hours away in order to get the healthcare they need. So it's been a really great opportunity to reach even more people than we otherwise would have thought of when COVID moved us all to this new virtual landscape. And I do have a video that I want to share from the Dempsey Center of one of our Cooking Matters classes. So could you please roll the video?
So we're going to roast 2 chickens. We also
Nutrient-packed recipes with fresh ingredients
that really good crispy skin,
from a professional chef.
which you're not going to eat because it's not good for you. But it's going to help the skin dry out, which will result in a really nice crispy skin.
This is Cooking Matters, a weekly class at the Dempsey Center in South Portland. Thanks to the Good Shepherd Food Bank, this program is free. Cool. And the students here are all in, committed to eating healthy.
There you go.
And they all have one thing in common.
I'm lucky. I'm one of the lucky people.
Their lives forever changed by cancer.
You don't go back to the life that you had.
Lori Allen is a breast cancer survivor, still undergoing some treatments.
You're tired, you hurt, you don't feel like cooking. This just sort of reinvigorates you.
Others are caregivers, but here they're all in the fight together.
It's an incredibly peaceful, non-judgmental atmosphere, and I think that's what really makes it here. I went to Pilates this morning. Just saying.
Proving cooking healthy matters.
It makes you excited to think that healthy food doesn't have to be boring.
In South Portland,
It really kind of inspires you.
Lindsay Mills, News Center, Maine.
So I hope that you got to see that the cooking classes, they offer more than just cooking. It really is also a great opportunity for people to come together and to learn together. And we're finding that's even happening in the virtual setting. And particularly some of the classes we've had at the healthcare facilities is one doctor who's done several classes through an obesity clinic she's doing a class with families for children who are in her obesity clinic. And these are kids who are used to having to come to the hospital on a regular basis for different needs. And one of the kids said that when he goes to the cooking classes, he said, for the first time ever, I'm going to the doctor's office and it's something I'm excited about and having a really good time. So it's a great opportunity to connect with patients. We also hear from a lot of healthcare practitioners that taking the class alongside the patients really helps reinforce just the relationship as they're really kind of learning side by side. So I want to share a little bit about what's next for the food bank in this area. We're hoping to expand our produce distributions at healthcare facilities, as well as nutrition education with our healthcare partners. Our goal this year is to establish our first on-site food pantry that's fully integrated with a healthcare facility. The goal is to provide nutritious food and nutrition education resources for patients, community members, and employees at each location. We want to also implement what we're calling a closed loop referral process using a platform called Aunt Bertha. This is a platform we're partnering with Maine Health, and it allows the Maine Health providers and our community partners to when a healthcare provider makes a referral, that then when the patient is received at the food pantry, that the food pantry can then update the platform so that the healthcare provider knows that the patient actually did receive the food assistance services. We want to also continue to expand partnership with our healthcare organizations to start to collaborate in research so that we can begin to document the impact of the interventions on people's health. I mean, we certainly know that improving access to healthy food improves patients' healthcare outcomes, but to actually start to document those impacts will be incredibly helpful, especially as we look to continue to grow this work. Because ultimately, what we hope happens is that that we are able to transform when people talk about ending hunger, that this is not just something that charity does, but that ending hunger really becomes recognized as effective preventative healthcare, and eventually becomes something that's reimbursable, just like any other medical intervention, rather than just something that is in the area of charity. So that wraps up my formal remarks, and I'm hoping that we have questions so that we can have a little bit more virtual, at least, conversation.
Thank you so much, Kristin. That was a great presentation to learn more about what you all are doing, and especially your plans for the future. I love the idea of integrating nutrition as more of a preventative measure and getting it seen as an important component of medical and public health. So really commend you for all the work that you're doing. A reminder to folks to please, if you have any questions, use the Ask feature. You can enter those in and we'll take them as we come through. And while we're waiting for that, I wanted to ask, how do you integrate and maybe elaborate on it a little bit more, cultural competency and different and cultural food norms into the education classes and the food that you provide?
Yeah, so this is definitely an emerging area for the food bank, and one that we still have, we definitely still have lots of room for improvement, but I'll share some. Within Cooking Matters, we've held several classes that were led by New Mainers and other refugee communities. And what we did is we had a community member who already is well versed in understanding the cultural preferences, really help lead the class and really drive the class. And so that's been very successful. But we still have a ways to go of getting the food bank staff also well versed in that area. So where we've made some changes this spring, as we talked about, COVID has changed so much, and has really put a spotlight on issues that certainly weren't caused by COVID, but COVID has just highlighted, and especially the significant disparities and inequities that exist, especially within our food system, and certainly for communities of color. So this was brought to our attention very early on in COVID, that initially, when we were providing emergency food boxes, the foods that we were providing were not meeting the needs of many Mainers. And so we reached out and worked with some leaders within from the United Somali Women of Maine. I'm sure I get the names right, and then Maine Immigrant and Refugee Refugee Services. Yeah, sorry. And worked with them. They were incredibly helpful, and worked with our team to put together what we called a community redistribution grant, where we heard it wasn't just also that the food bank needed to have more culturally appropriate foods, but we really needed to put the decision-making authority and really the purchasing power directly into the hands of communities of color. And so we ended up granting over $200,000 to over 20 organizations that were all led by either Black, Indigenous, or other people of color. And that they invested in not only just purchasing culturally appropriate foods, but also investing in businesses that were producing culturally appropriate foods, as well as those some farming practices as well, and even including a halal meat processing farm in Turner. So we've learned a lot through that, and we've added 3 new partners in this space that are teaching us along the way, and so there's definitely going to be more to come. So as we say, we're combining learning and doable action at the same time, and doing the best we can. But to me, it's one of the bright spots of pandemic. I shared it's ridiculous that it took a pandemic for us to realize how much we were not meeting the needs of all Mainers. But at the same point, I'm glad it happened, and hopefully we're turning a corner.
Thank you. And it sounds like you're going above and beyond too, and not just providing the food, but empowering the communities, creating new partnerships. So that's really great to take that, whole 360 approach to the issue. Another question that we had come in from Carly is about the Community Health and Hunger Program. And she asks if that's working to target specific populations that may be more at risk for food insecurity, or are healthcare providers conducting universal screening?
Yeah, so a lot of our community health and hunger are happening at in family practices, and a lot of in pediatrics. So we are reaching a lot of children and children's sites, which we know are certainly one of the more vulnerable areas. I don't believe we're doing anything more targeted than that, with the addition of, we also have some specific connections working with some cancer sites, recognizing that for many families, the cancer diagnosis can be something that throws them into food insecurity, as well as realizing the impact that being food insecure can have on the efficacy of your treatment. So we've been working with several cancer-related healthcare organizations. And I also know our director of the program is on the call, and I don't know if there's a way she can chime in, but she might have more to share. But if she can't, her email is right up here on the screen, Laura Vinyl, so please reach out directly with more questions that she is far better equipped to answer than I am. I also put Courtney Kennedy's information up there too. She's our nutrition education manager and oversees the Cooking Matters program. And then I know in my talk, I also shared a lot of data, and their website is up there on the screen, where you can get a lot of the research and the sources of some of the data that I shared.
Thank you. And I'll also make a plug for Laura. She will be on a panel about medical screenings and community health on October 21st as part of our conference. And that'll start at 2:20. So I hope folks will tune into that one as well. But we do have another question. And this is, what relationships do you have with food pantries that are unaffiliated with Good Shepherd?
Yeah, so there are a number of food pantries that are not part of our network for a variety of reasons. And it's actually, I think, a blind spot for all of us, where we don't really have much contact with them. Fortunately, sometimes the food pantries that are affiliated with our network are connected with, if they have another community organization that they know are also doing food access, that they will partner at the local level. And so we tend to just lean into that, that they usually can handle at the local level, and if they need us to get involved, we will, but it's not something that we proactively reach out to.
Thank you for that. The next question we have is from Sarah, and she asks, what has been the most impactful shift in changing people's minds that all people deserve healthy food?
Wow.
Not an easy one.
I know. Well, I don't think we're there yet. I mean, and I think that that's our task, right? I mean, again, we talk about what are the silver linings of COVID. And for me, there has been such an outpouring of support around the issue of hunger. And there has been a lot of attention, like we talked about, COVID just put a spotlight on this issue and a lot of other issues that existed prior to COVID and are going to continue to exist post-COVID. And so how do we harness the compassion and the engagement that COVID has created and translate that into a full-on public awareness and acceptance that food is a basic human right that has to be made available to everyone, regardless of socioeconomic status. And so that is something that we are talking a lot about here at the food bank, of how do we not miss this opportunity, and really use, as we say, right, from great crisis comes opportunities. And I think this is our opportunity. So many of us, myself included, found myself having to stand in line for food for the first time, right? Back in early spring, when grocery stores were limiting how many people could go in at a time. And a lot of times you'd go in and the shelves were bare. I remember having things on my list of my kids saying, make sure you can get this, and wondering, oh gosh, what if they don't have that? What if they run out of this? And it was a real stark reminder of, hey, honestly, for most of us, it was an inconvenience, but hopefully it was a reminder that for so many people, that's their norm, having to wait in line, sometimes in the cold to get food, and worrying about, by the time you get there, are they going to have what you need? That is far too many people's norm. And that is not what food access should look like. I think hopefully many of you have heard me say this before. Food banking emerged to solve kind of two problems of food waste and food insecurity. So it's a solution, but it solves the immediate need of hunger for sure. But it's not going to end hunger. Food banking is not going to end hunger. The only thing that's going to end hunger is a systemic recognition of that food is a basic human right. And that we need to put in the system. We need to put the systems in place to allow everybody to have access to food in a socially normal way, where everyone can go to the grocery store, choose the foods that are most appropriate for their family, when is convenient for them, and to get all the healthy food that they need. And so, and until we reach that day, we will be here and we will work on continually improving the experience of food access. But I am the first person to say that food banks are not how we should be feeding people. We are here because the system has failed. And so we need to start working on fixing the system. And that is an increasing focus of the food bank. We are every year we are putting more and more resources into our public policy and advocacy work, because that is how we are going to fundamentally end hunger.
Thank you. And your points about, people who have privilege and who are able to access food, got to experience a little bit of what that was like when they went to the grocery store during COVID. Some of the other things we experience and continue to experience with the pandemic are increasing food prices. And I know some food banks and other collection organizations face difficulty because of the limited supply of food. So can you talk a little bit more about how that's impacted you all?
Yeah, it definitely, especially last spring. We what really shifted is not only did the demand go up significantly very quickly, but also it was the demand for shelf-stable food, right? It was the stores were all of a sudden bare of canned goods and pasta and things like that, and all of a sudden you couldn't get that. So we were scrambling to buy as much shelf-stable food as we could, but we were competing with all other food banks and all other grocery stores around the country. And so all of a sudden we were facing 10, 12-week delays in getting food that we needed. We had a point in the end of April where we ran out of shelf-stable food. It's the first time I've ever known that to happen at the food bank. It was eerie. We had a whole section of our warehouse that was just completely empty. And so we had to very quickly shift gears, and we worked with Hannaford, and we purchased $850,000 worth of gift cards over about a 4-day period. And we started giving those out instead. And so that was, I think for me, as just as a consumer, it was really startling to see how quickly our food supply chain could be disrupted, and how concerning that is. And I know, there's an intersection between food systems and healthcare, and I certainly share the concern around what has really happened with just the complete dismantling of regional food systems. And I think we saw the impact of that. We also were seeing higher food prices as well. Normally our purchased food is around 80 cents a pound. It's over $1 a pound now. And so we've definitely have felt that impact as well. And what we've been hearing, working with our partners at the national level, is that there's a real concern this is going to happen again this winter. So fortunately, all of the buying we did this spring, we definitely stocked up. We actually have a third warehouse, that overflow warehouse that we've been using, because now we do have a good supply of shelf-stable food. So we are feeling like we're in a good position heading into the winter. Our biggest concern is we don't know, like all of us, we don't know how bad it may get or how long it will last. So we're hopeful that we have set aside enough food, as well as we've set aside almost $1.5 million that is purposely not attached to anything in our budget, just to give us the flexibility to respond should something else unforeseen come this way. So and again, I think also for the food bank and for so many of our partners, the outpouring of support from community members has meant everything. We get a little bit of government funding, but not much. About 95% of our funding is all from private philanthropy. So we are incredibly grateful for the generosity of Mainers, and fortunately, that has put us right now in a pretty good position looking into the winter. But again, we don't know how long it's going to last. But as I say, we believe in the abundance of resources to pull us through.
Thank you. And that touches a little bit on the last question I wanted to ask, which is how can we all in the audience and community in Maine best help you? I know some of the advice I saw on social media was, if you have means and are able, don't hoard so much food, because there are other people who, can only go to the grocery store once a week, or, they don't have the same access. So is that advice you can give, or you would give, and what are other ways that we can help during the pandemic and just in general?
Yeah, absolutely. I mean, what we heard from talking with some of the national food suppliers too, is that they can handle the increased demand overall, but they couldn't handle people going and buying, 20 packages of toilet paper at a time. If the rest of us just buy what we normally need on a week-to-week basis, the supply chains will be fine. There's no need to hoard. So that's one thing. And then secondly is absolutely is the food bank will continue to need support, and so do the food pantries. They are almost all volunteer run, very small budgets, and they also need not only financial help, but they may have their own specific needs of items they may be short of. The food bank does not provide, for example, many personal care items. So those are always in high demand for our food pantries. As well as obviously PPE for the volunteers at food pantries. On our website, we do have on the homepage, there's a link to go to COVID resources. And on there is we have all of our partners with updated information on contact information and their hours, and encourage people. You can sort it by your town, by your county, find out who are the food access programs in your community, and reach out and see what they need. Do they need volunteers? Do they need money? Do they need hand sanitizer? And so there's all sorts of ways that you can get involved.
And thank you so much. We're just almost getting out of time. So I want to thank you, Kristin, so much for being here this morning. We really appreciate your keynote, and to the audience for all of the questions. Don't forget to complete the evaluation by clicking the feedback button, and we'll start around 11:20 back in again, hearing about how a community health team responds to COVID-19, followed by a presentation on job crafting. So thank you so much, Kristin. We really appreciate it, and
thank you.
Have a wonderful rest of the day.
Thank you. Good to be part of the day. Thanks, Heather.